Chronic illness and rehabilitation. A chronic disease is one that lasts longer than 3 months, and it refers to the pathophysiologic process that leads to a medical diagnosis. Patients often have more than one disease process. The term chronic illness is broad and refers to the lived experience of the patient with the chronic illness. Their experience is influenced by their perceptions of the illness, their age, gender, culture, as well as socioeconomic status. The terms impairment and disability are used today. The term handicap is not used as frequently. Early effects of decreased mobility include a decrease in muscle strength, generalized weakness, easily fatigued, joint stiffness, decreased coordination, abdominal distension, and metabolic changes that are detectable by laboratory testing. In long-term care, there is a registered nurse that acts as a supervisor, and licensed practical nurses are charge nurses. Certified nursing assistants, nurses' aides, provide most of the direct patient care. The practical nurse will admit patients and initiate care under the supervision of the registered nurse, and the practical nurse will delegate to the certified nursing assistant. Planning care for residents in the long-term care facilities, the practical nurse must keep in mind the overall goals of care for the facility are to provide safe environment, assist the resident to maintain or attain functioning, promote independence, and allow the resident to maintain or achieve their autonomy. Safety for patients and residents is utmost important to the nursing personnel. No matter where the nurse works, safety is always the first and foremost thought. Restorative programs focus on muscle strengthening and balance. The nurse needs to assess all medications to determine the risk of medication-induced postural hypotension or dizziness. Chemical restraints are tranquilizers or sedatives that will calm an individual and alter their behavior. Physical and chemical restraints use is restricted by law and is applied only as a last resort for safety when an individual is exhibiting a threat to themselves or others. The purpose is to ensure that restraints are used to protect, not hinder movement. Alternative measures are always tried first. When a security device is used, the least restrictive device is chosen. A variety of techniques will help provide a restraint-free and safe environment. All safety devices must be used only as a last resort and must be ordered by a healthcare provider. The environment can be structured so that the individual has visual reminders of the day, year, as well as the time. Environmental aids need to be readable. An up-to-date calendar should be a clock, a daily newspaper, or local television or radio news. The priority is to maintain a safe environment. Once a functional assessment has been completed, specific goals should be written to maintain the highest level of function possible for the individual. The need for rehabilitation services continue to increase with the aging of the population. Vocational rehabilitation is job retraining for the disabled individual. This will provide a means of contributing to their self-support. Rehabilitation is concerned with achieving a better quality of life. The majority of patients who require rehabilitation services are disabled as a result of a chronic illness. Some individuals may become disabled from a trauma that was occurred during an accident. Individuals who have had a hip replacement often are placed in a skilled nursing facility for rehabilitation before they return home. Many communities have a hospital with an outpatient rehabilitation program for patients with cardiac and respiratory problems. Rehabilitation services are scarce in rural areas, and individuals who have sustained neurologic injury or loss of musculoskeletal function because of an amputation, trauma, or disease often go to a rehabilitation center miles away from home. Programs within large cities are often available for vision or hearing rehabilitation. Most burn centers have comprehensive rehabilitation available for burn patients. Cardiac rehabilitation focuses on exercise, diet, medications, and support groups. The nurse assists in ensuring that the patient correctly performs exercises and activities as instructed by the various therapists, as well as reinforces their teaching. A collaborative or interdisciplinary care plan is followed so that each member of the team is aware of the treatment and the education the patient is receiving. Both short-term and long-term goals are set. This provides for continuity of interdisciplinary care, recognizing the critical component of each discipline in promoting positive outcomes. Team conferences are scheduled regularly for members to collaborate on the patient's care and evaluate the rehabilitation process. The nurse that works with rehabilitation patients needs to be flexible and creative while recognizing that the patient is the captain of the rehabilitation team. The nurse's function is to assist the patient to achieve an optimal state of wellness, as defined by the patient. It is of vital importance that nurses be non-judgmental and not impose their own values and attitudes on the patient. Therefore, the nurse needs to remain non-biased. There are often two levels of the practical nurse employed in rehab facilities: a licensed practical nurse 1 and a licensed practical nurse 2 with intravenous therapy and functional independence measures certification. The practical nurse 1 does not infuse any IV therapy but does all the nursing activities except for an assessment. The practical nurse 2 performs the same functions as the practical nurse 1, plus any task involved with IV infusions. At least 1 year of medical surgical experience is required for employment as a nurse in a rehabilitation facility. The practical nurse initiates and participates in updating the team plan of care in collaboration with the registered nurse to meet the patient's needs. The practical nurse assists with patient and family education by supporting the outlined teaching plan and reinforcing the education. Any barriers to the patient or the caregiver readiness to learn are reported by the practical nurse to the supervisor. Recommendations are made by the nurses to the team members on how to facilitate learning. Learning outcomes are then evaluated and documented. The practical nurse is an active participant and facilitator of both structured and non-structured learning experiences. Leadership functions of the practical nurse are to supervise the patient care assistants, the certified nursing assistants, and the nursing rehabilitation technicians. The practical nurse can act as a preceptor for the unlicensed assistive personnel as needed. As a member of the team, the practical nurse carries out all normal patient care nursing duties and provides input and feedback to the team. When assigned, the practical nurse will carry out quality improvement activities. For home care in most states, the practical nurse must have 1 year of experience in working in an acute care facility. Routinely, the practical nurse working in home care is under the supervision of an RN case manager. The practical nurse may provide private duty services for an unconscious individual who needs skilled nursing care such as tracheal suctioning or tube feedings, performing home visits to change dressings, monitor blood sugar levels, or the practical nurse may be acting as an in-agency supervisor by coordinating home health aide visits and supervising their work. The family provides assistance with personal care, and a home health aide may visit a few times a week to bathe the patient and/or shampoo their hair. Homemaking is provided by family members or by a homemaker aide. Sitters may be hired to attend to the patient's needs at night if the family cannot provide the service. Nursing care plans are formulated considering the 24-hour needs in collaboration with the patient, family, and other healthcare providers. Case conferences are conducted regularly, even if they are done by the case manager on the telephone with others involved in the patient's care. Medicare requires a case conference every 60 days. Each visit to the patient includes a physical assessment of the identified problems and of the nutritional, home safety, elimination, skin, and psychosocial status. All findings are documented, and the nurse also documents data indicating that home health nursing care is still necessary. Between visits, the nurse may contact the patient or family to check on various aspects of care or to see if they have any concerns. Some home care agencies have an assessment tool for caregiver stress. When caregiver stress is high, calling the agency social worker for a consult can provide either more help for the caregiver or a respite program that might provide the caregiver a few days of needed rest and relaxation. A respite program can provide room, meals, and care for a patient while the caregiver is relieved of all responsibilities.